One of the things that's unique about CIASP is we're about creating resources for the industry by the industry. So we have safety professionals and we have licensed clinical social workers that work in the construction industry and researchers, and they all come together to provide these materials that anyone can use. We want to make sure that they're all there, but they're also free. So we have things like toolbox talks and a free mental health screening and safe messaging guide and a warm handoff document that you can use for after a critical incident or when you're in the middle of a critical incident with someone who has a mental health concern.
Good morning, Sonya. Welcome to Grow Healthy, Help People, a podcast that Accordis puts on. How are you this morning?
Well, thanks. Thanks for having me.
Good. I'm so glad you're here. So, I'm excited to learn more about the Construction Industry Alliance for Suicide Prevention. And before we really get into that, I would love to know a little bit more about you and kind of where you're from, where are you calling from this morning, all the things.
Yeah, absolutely. So I'm right outside of Philadelphia, Pennsylvania.
Okay.
So in a little suburb. So I'm not quite in the city, but I just call Philadelphia home. Makes it
Yeah.
easier. Absolutely.
Awesome. Okay.
I come from construction, like construction,
Yeah.
remodels, refreshes, facilities maintenance. I have been involved in the volunteer side of mental health for some time. I'm a lost survivor, so I lost my sister to suicide 18 years ago, and I volunteered for many years with the American Foundation for Suicide Prevention. And so when I had an opportunity to join CIASP, it really felt like my dream job, a chance to merge what I love about construction and what is I'm passionate about from a mental health side.
Right, absolutely. So, as far as construction goes, is this something you grew up in? Was this something your family did, or something that you started as an adult?
Interestingly enough, so Philadelphia, if you know anything about sort of our business market here, it is a place where franchising starts in many ways. So my first job out of college was with the automotive aftermarket. I worked for Amco Transmissions and then moved to Mako Collision Repair and Auto Painting, which is they were started by the same ownership. But what happens in this world is that you move from one franchise organization to another franchise organization. And at the time, I had some coworkers that moved to CertaPro Painting, and they happened to own the company that I started working for, which was Brand Point Services. And so that's sort of, you move with people that you know and that you trust. And so that's how I ended up in that world. It's not something I ever imagined, but something I fell really deeply in love with. I love so many things about construction. I loved the fast pace, always changing. Your world is different every day. It is a very male dominated industry, and I felt like it was just a place that felt like home for me. And so I would probably still be there today if I hadn't seen this position that felt like my dream job. So when I saw the ad for this position, I was like, wow, that takes all of the things that I am passionate about and puts them in one place. And I hesitated. Even I had been with my company for over a decade and wasn't looking for another position, but I felt like this had to be something I kind of shot my shot at. And here I am 3 years later.
I mean, absolutely. When you get that opportunity that meshes two things that you're so passionate about, it's really hard to turn that down. That's incredible how that happened. So tell me a little bit about what you guys do and your goals and your focus.
Yeah. So I am really lucky. I will start out by saying that from someone who runs a nonprofit, your board really matters. And I have what I often call a unicorn board because they are an incredible group of people. And I've been with CIASP for 3 years, but really the organization started. If you go back far enough to when the concept even came about, it was in 2015. There was an article written in CFMA, or the Construction Financial Management Association's magazine, and it highlighted the fact that there's a growing problem with mental health and suicide in construction. That article was written by two really leaders in this conversation at the time, which were Dr. Sally Spencer Thomas and Cal Beyer. And they said, we have to do something about this. And CFMA took up that mantle then, and they started having summits around the country. And then, not long after that, the CDC came out with their first report that said that construction is number two. And if you add in extraction or mining, it becomes number one from a suicide standpoint by industry. And so, as those summits were happening, it was ultimately decided that it was a much bigger conversation than should be tucked up under another organization. And they formed their own 501(c)(3) in 2018. From 2018 to 2023, it was a 100% volunteer run organization. And the board members really did an amazing job putting together the foundation of who we are. And then when I joined, I was really able to just sort of drive the ship into open waters and to get some of the things that they had been building on kind of over the finish line and start continuing to really build as to who we are today, and to do some really fun things. I mean, I get to do amazing things every day that I would have never imagined doing that are directly impactful to the industry.
That's amazing. So, tell me, when you talk about the mental health side and the fact that construction is number two,
Mhm.
sometimes number one, depending on what you get include into that,
Yep.
what is it that makes construction that high on the list? What is it about construction that causes that to be so prevalent?
Sure. There's so many risk factors that go into it that we just don't think about because they're just sort of part of what construction is. But there's chronic pain that comes from doing this job day in and day out. There's isolation. We ask our workers to sometimes go hours away from home and be on those job sites for long periods of time. There is a, co-occurrence of substance use or misuse that happens when you kind of couple those things together. There's a large veteran population, and veterans come with their own risk factors. And when we add that into the conversation, there's financial instability, there's access to lethal means, there's a multitude of risk factors, and they stack on top of each other that really make it challenging in many ways. And the fact is that all of the things that we love about construction workers, the things that made me enjoy my job so much, are that, pull yourself up by your bootstraps, get it done at all costs, that sort of tough, gritty mentality. But those are also the things that keep us from seeking help when we need it.
Right. Yes, yeah, I can see that, I can see that. So, tell me the ways and the programs that you have in place that really are out there to help construction workers. What do you have in place? What are you out doing to provide those resources?
So it is really about creating resources. One of the things that's unique about CIASP is we're about creating resources for the industry by the industry. So not only do we have an amazing board, but we also have subcommittees and we have additional volunteers that help create those resources that are truly living this day in and day out. So we have safety professionals and we have licensed clinical social workers that work in the construction industry and researchers, and they all come together to provide these materials that anyone can use, whether you are a union or a merit shop. It doesn't matter to us. We are 100% labor agnostic. We want to make sure that they're all there, but they're also free. So we have things like toolbox talks and a free mental health screening and safe messaging guide and a warm handoff document that you can use for after a critical incident or when you're in the middle of a critical incident with someone who has a mental health concern. So we've got a plethora of available tools on our website. And then we do things like have a podcast so that if that's not how you're going to get the information, maybe you love to listen to a 20-minute podcast and hear a conversation
Yeah.
we just recorded one today with a safety professional who does comedy on the side. And so he likes to
Oh,
mix
that's awesome.
laughter into these
Yeah,
conversations.
yeah.
We also have a webinar series where if that 20-minute conversation isn't where you feel like you're going to get the connection that you need, then we have 1 hour series. We do them every other month, and they talk about things that are a little more in depth, a little bit more serious. Sometimes there's a panel on that conversation. And so we want to really create spaces and places where anyone in the industry can tune into and find
Right.
something that they need to be able to either take care of their own mental health or the mental health of someone that they care about.
Yeah, absolutely. That's wonderful because not only are you providing in your area, but really anybody all over the world can find you guys and find these resources. So it's not just limited to where you are.
And we are working to translate many of them as well. So some
Yeah.
are currently translated, some are in the process of being translated, so that we are, again, creating as many spaces where people
Yes.
can find themselves.
Wow. That's wonderful. So, is there do you guys go to construction sites and provide on-site training for leaders
Mhm.
to know what to do in times of crisis for some of their employees?
We do. Yeah, I mean, one of my favorite things to do is speak to either a job site stand down or a town hall or any opportunity where myself or even my board members can come and share a little bit about the statistics, some of the risk factors that we just talked about, and then some of the protective factors that we can all put in place, warning signs, and then resources, because that's really what we need to be able to get into people's hands.
Yeah, absolutely. And I'm sure that many of these construction workers have families.
Mhm.
And I can only imagine that these resources are so beneficial for families also to be able to recognize if something's going on with their spouse or their loved one, that they can see these signs and get help and
Right, absolutely. I mean, the
yeah.
one thing that I would love to make sure everybody knew about is that there is a national suicide prevention crisis lifeline. And if we just remember one thing, it's 988. Making sure that we know that you can reach out to 988, whether you're in crisis, you're concerned about someone who's in crisis, or you're with someone that's in crisis. And they don't have to be just obviously a construction worker, it is a national hotline.
Yeah, absolutely. That's incredible. I think it's so important. Right now, we're really trying to focus more on mental health in the world. And I think it's so important for us to be able to locate those resources and have them readily available, no matter what situation or job that you're in, that you're able to get the help that you need when you need it. And we are going to have, guys, the link to their website at the end of this episode. So if you want to see any of those resources, then you'll be able to log on or get on there and kind of check those out after this is over. So tell me, I know that it is extremely difficult to run a nonprofit. A lot of times people think, it's no big deal. You're helping people, it's easy. But there's a lot that goes into running a nonprofit. So, in what you're doing, what would you say your biggest challenges are?
I mean, so we are not governmentally funded in any way. So obviously, fundraising is a huge challenge. And that's a choice for us so that we are, when there are challenges within any administration, that we always have a steady source of funding and we don't have to worry about that. So, it's not something that we worry about that funding being pooled in different directions. We want to make sure that those resources are always available. So that's always a challenge. And it's the hardest thing to get people to be able to volunteer for because it's the hardest thing that people do. It's not easy to ask for money. So that's probably the biggest challenge is the constant revenue stream that's needed so that you can create resources and you can translate resources and you can put out podcasts and all the other things to be able to touch the industry in some way.
Yeah, absolutely. So, for all my nonprofit leaders that are watching this, this is something that Aportis can really step in and help with. So, we can do fundraising strategy, we can do fundraising campaigns for you, and really work with you to get those donors in the door because we know how important it is to get the mission across to people and to really put out there what you're doing. And we want to be able to help with that. We can help you with anything from accounting to database work to website development and design and again with fundraising because we know that those things are hard and we want to be able to step in and help on that back end so that you can do your job and focus on growing the mission and spreading awareness. So tell me a little bit about how people can get involved with you.
Yeah, absolutely. So you can go to our website, which is preventconstructionsuicide.com. We actually have a space where you can request a speaker, where you can join to be a volunteer. You can follow me on LinkedIn. You can follow CIASP on LinkedIn. And we always have opportunities to share the mission there. One of the easiest ways to do that is just share a post that we make. We post 5 days a week. And so we want to make sure that as many people and as many places can see that message and our mission as well.
Yeah, absolutely. So when people are volunteering with you, what types of things are they doing as a volunteer?
So we have committees. We have three of them.
Okay.
One is an education committee where we're creating those resources together. So last year, our education committee put out I'm sorry, seven really strong resources that anyone in the industry can use. We also have a marketing and website committee. So we're always looking to make sure that we have the most beneficial website to the people that are going to need it. And so we're always looking at how to tweak that. And then, of course, that the marketing is all about the message to our constituents. So anyone that wants to hear or see that, we talk about campaigns that are sort of for the month and what we're going to do on that committee, and we help kind of plan that out. And then, of course, the fundraising committee. So those are ways that people can volunteer. We are going to do a couple of different things this year. So we will be launching a virtual 5K for the month of September, which is Suicide Prevention Month. We're going to do we will actually have our first in-person event, which will likely be in October as well. So more details on that to come. But we've got some opportunities for people to really lock in and be part of what we're doing.
Yeah, so that's definitely something people can look out for because a virtual 5K, you can attend that from anywhere and get involved easily. Yeah, that's wonderful. So I know you mentioned that you're working on translating some of those resources to get this out further into the world. So what else are you looking to do in the next 5 years or so to continue to grow what your mission?
Yeah, so we actually are launching in the middle of May a lived experience video, which takes the stories of four trades professionals and shares their experiences with mental health and addiction in either alcohol, prescription painkillers, or drugs and alcohol, and share that. And so then we will be launching that video and then a few others. Some other things that we're obviously looking to do is expand our reach and our resources library. We have launched, but we'll continue to grow something called our Pathway, which is a resource where someone can go and say, I need awareness resources, and they can kind of build that piece out of it. Or they might come into it and saying, I already have the awareness piece down. I want to build out more of an intervention. What does the training piece look like, and what tools are there for that? Or unfortunately, sometimes people have to enter the conversation from a postvention place and having had a loss or a critical incident. And so what does that look like, and how do they build out their program so that they don't have the gaps when it's needed? And so continuing to build that resource is one of them. And then there's always something that, comes up that we really want to focus on. And so there's, a full video library would be uh,
Yeah.
my dream, certainly.
Absolutely. That's wonderful. So, going back to something you just said, you guys are still there to provide resources and to help even after loss. This isn't just to
Absolutely.
prevent, this is after also.
Right, because as much as we try and as many things as we prepare for, unfortunately, there's still times where that happens. And so you need to know what to do after, we call it postvention, after that critical incident, and to be able to support your workers that are still there. There's something called contagion, and the chance of suicide increases for those that are left behind when that happens. And so how do we put those protective factors in place to make sure that we're doing everything we can to address what happened, but then keep those safe that were affected by it as well?
Right, absolutely.
Mhm.
So one question I have, because I am curious about this, mentioned this earlier that construction is very male dominated,
Sure.
right?
Mhm.
So do you see many on the female side? Is there as much of a risk? Do you see them struggling on the female side as much as on the male because they're a little more isolated in their gender in the industry?
Yeah, I mean, so overall statistics, men die from suicide more often than women, but women make more attempts. And it's simply because men choose more lethal means. So suicide doesn't discriminate. It doesn't matter what your skin color is, what your gender is, what your ethnicity is, any of those things. And so we need resources that are for everyone, and we need to create places that are compassionate and kind and healing for everyone in the industry. And that also goes to positions within the industry. So it's not just our trade professionals, it's not just our mid level supervisors or safety professionals, but all the way through our project managers or leadership as well. And so we need to create spaces where each one of them has access to the resources that they need based on how they're entering the conversation.
Absolutely. Well, Sonia, I have really enjoyed talking to you. I hope that if you are watching this, that you will check out their website, especially if you know someone in the construction industry, that you will connect them with these resources that are so readily available for you. And please make sure to watch after this podcast. We'll post their website link so that you can find it. We'll also post a link to a Cordis. But we would love for you to just reach out to us if you have any needs. And if you're in the nonprofit space, we would love to help you. But again, thank you so much for talking to us, Sonia. It's been great talking to you today and learning more about what you guys are doing.
Thanks for having me. Have a great
All
day.
right. You too. Bye bye.
Thanks.